As founder of Mastercard America, I'm excited to see all of you here. We are grateful to our founding expert advisor, Dr. Robi Tamargo, for being our speaker tonight. Learning from Dr. Robi's battle with long COVID for over 1,000 days and through stories shared by our patients in our community, we know that long COVID is a wide range of disabling and incurable chronic conditions. Tonight, we invited Dr. Robi to help us understand the neurological impact of long COVID, what happens when COVID damages the brain and the nervous system. I know you're all anxious to listen to Dr. Robi. Without further ado, I will pass the mic back to Sarah Cahill, who's the coordinator of Mastercard America. Thank you, Sarah, for hosting the webinar series for us.
Distinguished guests, it is both an honor and a testament to resilience to introduce our esteemed speaker for today's Q&A session, Dr. Robi Tamargo. Dr. Tamargo is a distinguished clinical psychologist with a specialization in trauma who's made invaluable contributions to the field while facing her own remarkable challenges. Graduating cum laude from the University of Maryland and later earning a Master of Arts in Child Psychology, as well as a Doctor of Psychology degree, also cum laude, from Loyola College and the University of Hartford, she's demonstrated exceptional dedication to her craft. Dr. Tamargo's commitment extended to serving 5 years as a naval psychologist and as a U.S. Naval Reserve officer, both domestically and abroad, providing critical mental health support to those in need. Sadly, she's faced her own battle with long COVID since 2020, which prompted her to seek post-COVID care in New York City and participate in long COVID studies at renowned institutions like Mount Sinai Hospital, Yale, and Massachusetts General Hospital. Despite the challenges she faces as a result of severe immunocompromise, Dr. Tamargo's determination to contribute to the understanding of long COVID and trauma continues to inspire us all. Please join me in offering a warm welcome to Dr. Robi Tamargo, whose resilience and dedication shine as a beacon of hope and knowledge today. Thank you so much for being here, Dr. Robi. So for everyone who is in the call, I just wanted to let you know that you have the opportunity to use the chat panel to ask any questions that you'd like. I will field them to Dr. Robi during the session. So please, as you think of things that you'd like to ask her, remember that her background is kind of in the neurological impact of long COVID, but she's also been a frontline worker through the entire pandemic in the VA hospital. So there's a lot of good areas of expertise about like COVID in healthcare and other kinds of issues that we can ask her about. So any question you have, please drop in the chat and we'll get to it. First off, Dr. Robi, thank you for being here. Again, we appreciate having you here. We wanted to talk today about the kind of the damage that COVID can do to the brain and the nervous system. So the first question that we got from our internet audience is, are we seeing these neurological effects in children and teens as well, or just in adults?
Well, thank you very much, Sarah, for that wonderful introduction, and Julie as well. It's such an honor to serve as founding members of Mass Together America, and Julie, you've really led the way for all of us. And Sarah, I don't know what we would do without your technological genius. And I just want to publicly thank you for all that you've done for helping to advance our cause. So thank you both. The most common persistent and disabling symptoms of long COVID are actually neurological. And as a clinical psychologist, I want to emphasize that this is not a psychological or psychosomatic disorder. This is a neuroimmune disorder. The most commonly seen neurological symptoms of long COVID is profound fatigue. Another major symptom, cluster of symptoms, falls under the umbrella of cognitive dysfunction, which is really manifest by word finding difficulty. You may watch me have that happen again tonight. Memory, attention, concentration deficit, sleep disturbance, sudden onset obstructive and central sleep apnea, and mood changes. So this cognitive impairment is colloquially known as brain fog. And I dislike the term. It's very widely used because it minimizes the profound neurologic impact of COVID-19. What we understand is that at this point, the current understanding is that the parts of the human body that are actually considered neurological are what are being heavily impacted by long COVID, such as pain, post-exertional malaise, which is an energy crash that people experience after very little physical or mental activity. And these symptoms are caused by a nerve system that directs our body to breathe, digest food, and basically runs all of our organs on autopilot. And that's referred to as the autonomic nervous system. And when the system's not working right, it's referred to as dysautonomia. And many of you may have heard that phrase, dysautonomia. And so it causes symptoms like dizziness and a racing heart, high or low blood pressure, gastrointestinal problems, loss of appetite, diarrhea, constipation. And as most of you are aware, one of the most common neurological symptoms is the loss or altered taste or smell. And all of the things that I've just mentioned are, in fact, neurological symptoms. So can children who had COVID-19 experience long-term effects? They absolutely can. They absolutely are. And it's really quite devastating for those children that have been stricken. So we're seeing these symptoms in children. And there's obviously concern that our youngest children are going to be impacted by this and that there's going to be long-term consequences that we'll only know in the years to come. So literally anyone, a child, an adolescent, a healthy young adult, as well as older people can, anyone who's had COVID, in fact, can develop long COVID, okay? So the formal name for long COVID is called post-acute sequelae of SARS-CoV-2. We also will call it PASC for short. Long COVID is also very commonly known. One of the big disease processes that were initially quite rampant in children who had COVID. They didn't realize initially, of course, that it was COVID, but they were seeing this tremendous increase of something called multi-system inflammatory syndrome. And that was really hitting children really quite hard. And it basically is exactly what it sounds like. All these different organ systems are experiencing inflammation, and that causes symptoms.
In the chat, Doris wanted to ask you, could neuropathy in extremities be a symptom of long COVID? Her doctors haven't found a cause.
Yes, absolutely. And those of us who are the early birds, the first wave long haulers, most of us by now have developed neuropathy. And once I developed neuropathy 18 months into this process, and I developed a disease process called Guillain-Barré syndrome. And I literally became paralyzed, and I was unable to walk for 6 months. And I periodically have episodes of difficulty walking and often have to use a wheelchair if I'm having to go anywhere of any distance. So yes, neuropathy is commonly seen in individuals with long COVID. And people are showing up with, as I mentioned, dysautonomia, and there's a common dysautonomic process called POTS, which is postural orthostatic tachycardia syndrome. And people are suddenly developing that, and they maybe didn't even know they had COVID, but all of a sudden their heart rate's going through the roof, 170, 180, 200 beats per minute, and they're just sitting on their sofa or lying in their bed. They're not doing anything, and their heart rate's going crazy. So this, in addition to the neuropathy, are often overlooked by the general medical community. They aren't putting the pieces of the puzzle together yet. I work in a primary care clinic as what's called a primary care behavioral health consultant. And I am seeing a lot of young people in the 18 to 34-year-old window who are being stricken with long COVID. And they've had a myriad of disease organ systems where they're developing all kinds of strange problems when they were otherwise extremely fit and healthy. And I might not look it now, but before I got stricken with COVID, I was extremely fit. I was working out every day. I was a super fan of Orange Theory Fitness. I went to the 6 a.m. class, sometimes the 5 a.m. class, and just something I've done for a few years. And I haven't been able to return to the gym since I got sick on May 7th, 2020. And I know that a lot of other people are finding that same issue. So the neuropathy is very common. Please direct your physicians to look on the CDC website. They actually have a beautiful list of long COVID symptoms, and neuropathy is on that list. So you might find it helpful. What we try to do with our talks like this is to educate people about resources so that you can literally print off studies and take them with you to see your physicians, so that they can see that, okay, this has come out of the blue. I was otherwise healthy, and now I have these problems. And might they be related to COVID? And if they can't identify any other reason, then we have to err on the side of this is probably neuro-COVID and not be gaslighting our patients.
Cora would like to ask, are there potential neurological impacts due to COVID infections reactivating human endogenous retroviruses?
Yes, we have seen that with herpes virus, Epstein-Barr virus, a number of different viruses are being reactivated. It's being watched very closely. I know it's being studied very actively. Those researchers those were their areas of interest, for instance, the ME/CFS crowd, which is typically caused by Epstein-Barr virus. They are very, very interested because folks with ME/CFS have been gaslighted for decades because there weren't enough of them for people to take it seriously. But with 65 million, at least, people around the world stricken with long COVID, there are enough people who have contracted a viral disease process and have developed symptoms that are quite consistent with what folks who have ME/CFS are experiencing.
Thank you. And a follow-on question to that. Are the sudden lower back muscle spasms some people are reporting occurring during COVID linked to neuropathy, or is that something else?
Well, it's, as I mentioned, it's a neurologic symptom. It may be neuropathy. And unless somebody does an assessment to determine whether you have a neuropathy with an EMG, nobody actually knows. So it's very confusing, because not only do we have neuropathy, but we also have neuralgia and myalgia. So we have nerve pain, muscle pain, and nerve injury, shooting nerve pains that could be something like you could have a deteriorating disc in your back, and that could get confused. Or you may not have anything wrong with your spine, and you're getting shooting pains down your leg, or you're getting spasms in your low back. And it's actually your muscles being caused by neurologic injury.
Thank you. So one of our questions from the internet audience was, why do you get COVID more than once? Aren't you supposed to develop immunity to COVID?
Well, I wish that were the case. Julie, am I on 6? I think I had my 6th case in August. And what happened to me, and what we're learning is happened to many, many other people, is that when you get long COVID, you have an autoimmune disease process going on. That's what's suspected. But what we are knowing is that we are immunocompromised. So our bodies cannot fight off COVID, much less all sorts of other things. I can't tell you how many cases of pink eye I've had, how many cases of thrush, which is a fungus in your mouth. And I have a fungus on my finger. It's been there for almost a year now. I have a fungus on one toe. They came at the same time. And finally, this second extremely lengthy treatment is starting to work. It's starting to finally take effect, but the treatment is incredibly toxic. And so it comes with other issues, but they know it's systemic, that these fungi or viruses that are getting activated are systemic, and we need to get treated for them. So you may need an antiviral, you may need an antiretroviral, you may need an antifungal, any number of different medications to help combat the immunocompromised status that we're in.
Sorry, would it be safe to say that getting COVID actually weakens your immunity rather than gives you immunity towards future cases?
That's in fact what they're seeing. There's no evidence, in fact, that there's any immunity caused by COVID. Different people are responding differently to it. We know that the vaccine does not prevent you from getting COVID. What it seems to do is to help people have a less severe course, but it doesn't protect us from getting it. The more cases you get, the more likely you're going to get long COVID. And the research is already demonstrating that.
Kristen would like to know if there are any treatments that can help some of those conditions. She has the fungus, the rash, the reactivated Epstein-Barr virus.
Christine, my heart feels for you because I think I've had probably 20 or more rashes of all kinds. My dermatologist just has me send pictures of all the crazy rashes just so they have a record of it. And then my thumb in different stages of the fungus, and my mouth with these crazy, bizarre fungi that don't look like anything else. And when they did the biopsy of my thumb, it came back as unknown. It was clearly a fungus, but they didn't know which one it was. So those are kind of scary things. So they gave me the normal antifungal, and it didn't work, which is terbutaline. That's not it. Terbinafine. Any other docs there? Help me out. I think it's terbinafine. And I did that for 3 months with completely zero benefit. And now for the fungus on my hand and my finger and toe, I'm on itraconazole. So those are things you could talk to your physician about to see whether those are things that you might be able to try. And obviously, we all have complex health issues. We have to make sure that it's not going to cause a problem with your medication. I had to adjust several of the medicines that I'm on, life-saving medicines, so that I could take the itraconazole to keep me from succumbing to a systemic fungus. Oh, the other thing I wanted to mention, I forgot, is if you have neuropathy, and it is clinically diagnosed neuropathy, the treatment of choice right now is immunoglobulin via IV. So it's the letters for it are IVIG, and that's immunoglobulin therapy coming in the form of an IV intravenous treatment. And some wonderful studies are happening, and that's what is being recommended right now if you have a positive EMG.
Thank you, Dr. Robi. What are long COVID symptoms that are considered neurological?
Well, extreme fatigue, and fatigue doesn't even begin to touch it. It's a profound level of exhaustion that you really don't even have words to describe to anyone else how it feels. No amount of sleep helps you feel restored. And it's just constantly with you. I have in 3.5 years, I haven't felt rested a single day. So that's it is on all the surveys that are done, that's the number one, is the extreme fatigue. Of course, the impaired memory, word finding difficulty, I mentioned, trouble speaking, having trouble with fluency, and losing your train of thought. So you're in the middle of something, you've formulated what you want to say, and you don't have the words anymore. Or someone asks you a question and you can't think of the answer. Like I couldn't think of the name of the medication. I gave a completely superfluous medication and nothing to do with fungus. You forget where you put things. You forget what you went to the kitchen for. I stood in front of my pantry just a couple of days ago. I had no idea why I was there. So I just turned the light off and shut the pantry and went back and sat down. And then my husband came into the kitchen and he opened the pantry door to look for the very thing that I was looking for, which was when my next IVIG treatment is. I get that treatment every 28 days, and I've had that for 1.5 years now. I refer to it as my life juice because Julie can tell you, I think Sarah can tell you as well, anyone who knew me when I was really battling for my life 1 year ago, January, probably didn't think I was ever coming back from that. I was down to 68 pounds. And when I started getting the IVIG, I really started turning a corner. And it took a while. It was months of that treatment. And then it was like, oh my gosh, the light bulbs started coming on in my brain. I could think more clearly. I don't forget as much. I still forget. What am I doing? Where am I going? What question I'm answering? I think my husband gets a kick out of asking me about a conversation or a movie or a television show that we just watched 2 days ago. And I'm like, I have no idea what you're talking about. And that's a really frustrating experience for both of us, because he's like, just that sort of immediate reaction of incredulity. Of course, he fully understands and is incredibly supportive. I have to tell you, my husband has been the most incredible caregiver over this entire 3.5 years. He is taking care of me and my mother. Both of us have been stricken with COVID multiple times. We both had long COVID, and COVID took my mom's life in May. So he deserves some massive kudos for all that he's done for us. I know he was very concerned about you, Julie, yesterday when he saw that you were at the hospital, and he messaged me and he's like, Julie's in the hospital. Julie's in the hospital. He wanted me to know that you were in the hospital. And he said, please give you his love. So we forget a lot. We have trouble concentrating. It's as if we've developed attention deficit disorder. A number of people have said that. I also say that I have become dyslexic in my typing and in my writing. I can't spell words that I used to be able to spell well within my wheelhouse, as I used those for all these years in my clinical practice, and I can't spell them. Difficulty working a calculator, working a remote control. Those things can happen. I caught myself. I started to say I'm rote, but I caught it, which is an improvement. You have a lot of distractibility, very easy to be distracted by things. And so that's the ADHD thing. People say, I've suddenly developed ADHD. We don't suddenly develop ADHD. So if you are suddenly developing ADHD, that's a neurological disease process happening, okay? Headaches, another massive neurologic symptom. And people who never had headaches before, who never had migraines before, are developing debilitating migraines. The trouble sleeping, the insomnia, trouble falling asleep, trouble staying asleep, waking up in the middle of the night and then not being able to go back to sleep, having nightmares, night terrors, hypnopompic and hypnagogic hallucinations. Let's see, what else? Obstructive sleep apnea, central sleep apnea. And people, I am a small person. When I was complaining that I'm gasping for air in the middle of the night, the first sleep doctor I went to, and this is really early, said, there's no way you could have sleep apnea. And I'm like, well, I would have agreed with you before, but I know what the symptoms are and I have them. And he refused to do an assessment. And so that was one of the deciding factors for my husband and I to go to New York, so I could actually get appropriate care at Mount Sinai Center for Post-COVID Care, because I knew that was a place that I would not get gaslighted. Let's see. I would be very remiss if I didn't bring up the neuropsychological aspects of long COVID: anxiety, depression, post-traumatic stress disorder, psychosis, obsessive compulsive disorder, seizures, tremors. There's this experience where there's a tremor inside your body. Your whole body is shaking. You have absolutely no control over it. If you wanted to, you can't stop it. And that's important to tell your neurologist. Paresthesia, where you're having numbness and tingling, not just in your extremities, but random parts of your body are suddenly numb, and pins and needles all over it. The neuropathic pain that we talked about, muscle and joint pain, random joint pain. I sat with a patient just yesterday. He's very young, active duty sailor, and he has had to have a knee surgery and a shoulder surgery. He absolutely has post-acute sequelae of SARS-CoV-2. He's had COVID 4 times, and he is now failing his knee surgery. He's developing symptoms again. And we're seeing this with people. The other last aspect that people might not realize is actually a neuro-COVID symptom is the cough and the shortness of breath. Yes, there may be pulmonary injury, but what they're seeing is that this is actually being controlled by the autonomic nervous system. And people are having issues with their vagus nerve, interfering with their ability to swallow, choking, and all the different things that the vagus nerve controls as well. So I hope that answered your question about all the neurological impacts.
Doris wanted to ask, she's had muscular and joint issues with neuropathy, but she's told RA is under control. So is a second opinion from another neurologist a good idea?
Absolutely. I never had rheumatoid arthritis, but when I was in the hospital with Guillain-Barré syndrome, my markers were crazy. And then maybe 2 weeks later, they were normal. And a few weeks later, they were elevated again. So this whole autoimmune process, which rheumatoid arthritis is, it's an autoimmune disease. I also want to mention, like rheumatoid arthritis and other neurologic disease, autoimmune diseases, tests don't show anything wrong. You can have a completely normal looking MRI. You can have normal EKG, ECG, EMG, LMNOPG, and hopefully everyone's laughing. That's not a thing. The tests aren't sensitive enough. Now, how do I know this? When I left here in October of 2020, I couldn't breathe. I was on 60 milligrams of prednisone, all kinds of inhalers, and my chest x-ray showed asthma. I have never had asthma in my life. I've been a competitive runner since I was 12 years old. I think I would have known if I had asthma. When I got to Mount Sinai, they enrolled me in a study in which I got to participate in a 7 Tesla MRI PET scan. And I had it again. 12 months post-COVID, I still had ground glass opacities in my lungs that weren't shown on the MRI that I had done at Mayo Clinic. That's dramatic. And so people are having all kinds of tests done and they come back negative and they're getting shooed away. So I'm going to plug someone. I get no benefits from this whatsoever, but this man has saved, I think, the huge majority of long haulers that were sick in the beginning. And his name is Jez Medinger. And he is on Twitter, aka X, as Jez Menninger, and he has a YouTube channel. And if you simply put his name into any search engine and put long COVID, you are going to be introduced to a plethora of educational videos. Prior to getting long COVID, he was a filmmaker. And he was so sick. And I remember early on in our small groups, and he would be sharing what was happening to him and how crushing it was for him emotionally that he wasn't able to work. And he talks about this all on his YouTube channel and his videos. They are magnificent. This man should get a World Health Organization or some massive medical community award for his level of advocacy and education about long COVID. It is absolutely phenomenal. And every top name in long COVID research, I don't think any have gone uninterviewed. And so anybody who has questions, go check him out. It's Jez with the G as in George, E, Echo, Z, Zebra, and then Medinger, Medinger, Medinger. Phenomenal guy. And I think that if you spend some time with your surfing, looking at what he's got to offer, I think you would be incredibly impressed. We should have him come on our show.
I put his YouTube channel and his book in the chat for anyone who's looking. Until Robbie spelled his name out, I was searching for Jazz, which was not correct. Got a lot of good music recommendations, though.
He has an amazing British accent, so it's a lot of fun to listen to. Everything's better with the British accent, long COVID included. I wanted to say one thing before we're out of time. We were talking about children, and I think that if your children are experiencing any of these kinds of symptoms, or they're having just weird physical symptoms, sleep issues, concentration, attention, and they didn't have this before they were a sixth grader. They didn't have it when they were first, second, third grader. We don't develop attention deficit disorder at 12. We develop it early. So talk to your children's teachers. Even your college-age children may need a little help communicating with professors and asking for accommodations, because people don't know that we have protections. The American with Disabilities Act, and I think other nations around the world have similar things where there are protections so that you don't get fired, you don't get kicked out of school, you don't get failed because you have a disability. One of my dear, dear friends' daughter is 1 month longer COVID than me. And she was in her first year of medical school. And she has continued. Her school has been magnificent. She's had to take entire semesters off, lengthy periods of time off with her long COVID symptoms and reinfections, all the things that I'm talking about. The fatigue, the inability to study, to concentrate. And this young woman is a stellar student, just, absolutely brilliant young woman. And she's struggling to get through medical school, but she's going to get there. And I promise you, she's going to be a better physician because of it. So take your children to COVID-aware neurologists and COVID-aware psychologists to make sure they're getting the proper treatment. And obviously a COVID-aware pediatrician is essential.
Thank you. Lisa would like to know if any of these neurological symptoms are progressive or degenerative over time, or do we not know yet?
Well, the clinical answer is we don't know yet, because you can't make clinical proclamations until there's actually sufficient evidence-based research to demonstrate that is indeed a fact. And we're only 3.5 years into this disease process, which in the world of science is nothing. But I can speak anecdotally, and I have improved in several areas tremendously. I literally had a headache for a year and a half. And then I developed Guillain-Barré, which is a degenerative disease, 18 months into long COVID. And I have had just recently, I think Julie may have shared on our platform, just on Sunday, I had to have an MRI of my spine because I have such extreme pain in my left hip. And I've seen all the docs. The wonderful hip guy said, yeah, you have a torn labrum in your hip. Did you do anything to cause that? No, I just woke up like this when I was about 3 weeks into my last episode of COVID. And he said, there's something more going on. So he sent me to a spine, because all the orthopedic folks have their specialty, sent me to a spine doc. And then I just saw my MRI results, and my spine's a mess. And I have all kinds of cysts. I have Tarlov cysts and synovial cysts and a herniated disc that's pushing against my spine, severe degeneration of my spine. And I had it done at Mount Sinai, so we have something to compare it to. So there's been a profound deterioration in my spine since my MRI at Mount Sinai. So so yes, I can speak from an N of 1, which is simply anecdotal.
Lisa would also like to know, do you imagine that a lot of long COVID symptoms in kids are being dismissed as a result of lockdowns and precautions?
Absolutely. I see it being dismissed a lot of places because particularly I live in a state in which COVID doesn't exist, which is Florida. You might see that I have this beautiful background. COVID doesn't exist here. So people don't get tested, and they'll tell you, no, I don't have COVID. It's allergies. And so children who are frequently asymptomatic, and young people are frequently asymptomatic, are still developing long COVID symptoms. We need to keep that in mind. So if you're seeing unusual symptoms in your child, changes in their mood, changes in their affect, changes in their energy, changes in their ability to focus and do their schoolwork, or their interest in school, or their interest in their soccer or baseball or field hockey or lacrosse or football. They don't want to do those things anymore because COVID is wreaking havoc on their brains. So yes, I think it's underreported, it's unassessed, and undiagnosed and untreated.
So Amy wanted to ask, a long hauler friend who's a physician has likened long COVID to MS, but affecting the autonomic nervous system. Is the medical community catching on yet? I can't access IVIG for anything, and it's so discouraging.
Oh, I know. Well, I can tell you the researchers are. And there are studies using IVIG, and maybe if you go on to the National Institutes of Health and look for the studies, maybe you can put that link up, Sarah, so people could go, and there are IVIG studies being conducted, and maybe you can become involved in a study. And I have a dear friend of mine who has ME/CFS, and then she developed long COVID, and her insurance will not pay for her to have IVIG. And fortunately, her parents were of the means to pay for it for her. So she's getting it out of the generosity of her parents, probably their retirement account. It's really expensive.
Doing some quick Googling, but I may have to come back to this. I'm not necessarily finding the right studies immediately, but there's at least one here on the efficacy of intravenous IVIG on COVID-19 related neurological disorders over the last 2 years. So certainly Google IVIG long COVID, see what studies come up. Do your own research. No, just kidding. Don't do it. Listen to the studies. That's what we recommend here. We have experts. Let's listen to them.
And there are a lot of studies on blood clots as well. And Dr. Risa Pretorius, she's from South Africa, another awesome accent. She's on Twitter X as well. And she's got so many studies going on. And if you spend it wouldn't take you very many minutes on Twitter and long COVID, and you'll find out who the researchers are. Akiko Awasaki from Yale. I don't know how many of her studies I've been in. She's just amazing. Avi Nash is doing studies at the National Institutes of Stroke. Avi Nash, AVI. Avi Nash. I can't spell Avi's whole name. Nath, not Nash. Nath. Nath, Avi. National Institutes of Stroke and Neurological Disorders, I believe. So yeah, there are a lot of people. We're not really alone. It might feel like we're alone, but we're not. We just have to connect with each other. There's some wonderful websites of long haulers. One that really saved my life initially, my husband found for me, which is Long Haul COVID Fighters. And Amy Watson was the founder of Long Haul COVID Fighters, and she was the one who coined the phrase long haulers, and it caught on around the world. And that's Amy Watson, and she's on Facebook, and you can find her and just type in Long Haul COVID Fighters, and you'll see the amazing work that she's been doing. There are many, many physicians who have been stricken with long COVID, psychologists, psychiatrists, primary care physicians, cardiologists, you name the gist, and we've all been stricken. And so many of us are trying to still find some purpose to our lives because we can't really work at our capacity. So we're trying to do something meaningful and try to help other people, protect them from going through the same things that we went through, because there are only going to be more and more people getting long COVID.
Thank you. I was able to find, I'll just share this in the chat. Obviously, I haven't had a whole lot of time to read through these, but the NIH has a page on the clinical trials that they're doing for different long COVID treatments. So that would be, there's at least 2 trials that are active as of last month. Looks like one of them is about Paxlovid, and one of them, yep. So that would be something to look into. I just dropped that link in the chat. And all right, let me get back to my questions list here. Do you know if patients who are being infected with the more recent strains are also developing neurological long COVID symptoms?
What I'm understanding is yes. In talking with my neurologist, he is seeing continuing symptoms that are lingering beyond what would be expected. So anything after a month is considered long COVID. The longer out you are, the more you know. Or if you have sudden development of symptoms. For instance, I was stricken with atrial fibrillation 3 months into my battle, just out of the blue. And then I've had multiple other things decide to take up residency in my body because of what's obviously researchers haven't fully determined what's happening to us. We do know that there's neuroinflammation that is seen on autopsy. There have also been autopsy evidence of viral reservoirs. No evidence that the virus is alive, but doesn't mean it's not. We just haven't been able to identify that yet. And there are biomarkers being identified as well in the blood. And they're not mainstream blood tests yet because these are extremely expensive tests and they're being studied. So they're in studies. So there are things that you can get involved with in studies in the biomarker studies. So those are I forgot to mention the autoimmunity aspect, which we've been talking about. So neuroinflammation, autoimmunity, and viral persistence or viral reservoirs are what are believed to be the underlying issues with long COVID.
Lisa is wondering if there's a difference between long COVID where the symptoms just keep going after you get infected versus symptoms that appear later that are not necessarily connected to your acute illness. Is there like a difference in how that's described, or are they all kind of under the same umbrella?
They're under the same umbrella, and there are people who have believed that they were recovered, their symptoms were mild, and then they would get stricken with something else. And other people just never fully recover. I've never fully recovered, but I'm doing really well. And really, I've got the cognitive issues and I have a profound sleep disorder that I developed. I have central and obstructive sleep apnea, and I have a BiPAP. I have to take 4 sleep medicines or I don't sleep. And so if I don't take them, if I didn't take them tonight, I won't sleep. I'll still be here tomorrow wide awake. So it can happen in any way, shape, or form. That's I think what I've seen talked about in the literature is that it's this quizzical aspect that there's not a typical course as there are with many other diseases. So we can't say, well, this is going to happen and then this and then this and then this, and then we're going to see an improvement. It's not how it's working. There's no rhyme or reason to why one person has a fatal bout of a disease and another person has a severe case and survives.
All right, we are coming up on the last 10 minutes of our session, so I just wanted to give you a chance, Dr. Robi, if you have anything that we didn't cover tonight that you would really like to discuss, or if you have any closing thoughts that you'd like to share with the community, the floor is yours.
So I had made a note for myself to make sure that I mentioned that Boston Children's Hospital is doing a new study that and in the data so far, and they're publishing this data, they think that children should be monitored for cardiac as well as neurological and psychosocial complications of COVID. So, and obviously I mentioned the multi-system inflammatory syndrome, but what they're seeing is later on in children as well as adults that we start to have these heart, lung, blood vessel, kidney, digestive system, brain, eyes, skin. And you can get inflammation anywhere in your body. You'll get a random stabbing pain in the middle of your arm or in your neck or in the top side of your chest. There are no organs there, but you get this horrible pain. You think you're dying. And there's nothing there for it to be other than probably a microclot, according to Riccia Pretorius. So I know what I was going to mention. I don't know if I mentioned this already. I apologize because I don't think I did. But I developed a blood clot. I knew that I had microclots early on into it because I had about a month and a half in, I developed COVID toes, except I had COVID feet. And my blood vessels were all really large. And I had a pinpoint ice pick stabbing pain in the top of my left foot in one of my vessels that was inflamed. And I was counting how many times I was getting stabbed in an hour. I was doing little ticks because I was trying to work and talking to a patient, and I was like making little ticks, and I was having 24 stabs in an hour. And so I reached out to my neurologist, and he put me on a very low dose of a blood thinner, and it was Eliquis, and then, gosh, lo and behold, I got a blood clot. They increased me to 20 milligrams, and I got another blood clot. And then they switched me to Xarelto, even better, got another blood clot. I have a pretty significant blood clot behind my left knee, so much so that my body has completely developed another blood vessel behind my knee. It's a popliteal vein. I have an entirely new one. And so they're getting a kick out of that at the hospital. But what I wanted to mention, we were talking about test results, the D-dimer that tells you that you have a blood clot, every time I had a blood clot, my D-dimer was negative. The inflammatory markers that are traditional inflammatory markers, negative. But not on the study tests that I was in, because I was participating in these studies, and they were doing my blood, and my scores were off the charts. But they're not mainstream. Insurance isn't approving them yet, right? They're only available in studies. So those are a few other thoughts that I have. Otherwise, I think I mentioned everything. Julie can be my brain.
Thank you, Dr. Robi. I will hand it back to Julie. I know she had a few closing words for us before we are done.
Well, I was in the hospital for sleep apnea endoscopy yesterday. And so talk about long COVID. That's a long COVID symptom that I developed after having after getting COVID from the Omicron wave. So that answered one of the questions, whether you will get long COVID from the recent strains. Yes, you do. Anyway, we are very grateful to Dr. Robi for sharing her battle with the beast with us. Through her struggle, we learned how COVID-19 can wreak havoc to a perfectly healthy person and disable them. A new wave has started in the United States at the end of July. Both hospitalizations and mortality are climbing every week based on CDC's limited reports. The world needs to listen to COVID-19 long haulers and millions of families who have lost loved ones and parents with children suffering from long COVID. Most Americans don't know anything about long COVID. It's because of lack of awareness from the CDC and the White House. I am grateful to our team working together to create this webinar series, especially to Sarah Cahill for being a wonderful host, and Heather McTamaney for helping us organize the event. And I also want to thank the audience for joining us tonight. Even though researchers have started clinical trials on treatments for long COVID requires comprehensive care and a complicated diagnosis process. Healthcare isn't free. Unlike countries like in the UK, we don't have safety nets or healthcare for all in the US. Hospital bills and costs for medication can make an uninsured person homeless, even if you are insured. That's one of the most tangible reasons why prevention is always better than treatment. Everyone's immune system is different, and individuals' immune response to the virus was found to be one of the underlying causes of long COVID. And let's remember that roughly 3/4 of the people in the US are in the high-risk group. That number doesn't even include children. The high-risk community is in the blind spot now, and that includes long haulers who have been disabled by organ damage and chronic symptoms. I just gave you all the reasons to support our awareness campaign. Please follow us on Facebook, Instagram, and Twitter. Please join our group. It's called Mask with Us. Let's raise awareness to help reduce the spread of this rapidly mutating virus by improving indoor air quality and using tools like mask testing and isolation to keep everyone safe. Good night to you, and I will see you all next Thursday at 6 o'clock Eastern Time, and that's Dr. Angelique Cawthor's webinar.
Dr. Korthels next Wednesday is hoping to speak about the boosters. So if you have any booster related questions, this will be one that you definitely do not want to miss. So please come join us next Thursday, and I hope you all have a great rest of your night.